to dwell upon two very vital aspects. The first one is culture and self. And the person who has done years, decades of work in this field is here with us on this occasion to talk on this topic, Professor Girish Mishra. He's a professor in psychology, Department of Psychology, University of Delhi. The other vital aspect pertains to the applied aspect, the pragmatic aspect, which is the role of communication in counseling and family therapy. It's often said counseling is often the art of listening. Communication forms a key element in the context of the delivery of services in the domain of counseling and family therapy. And to talk on this aspect, we have with us Professor Manju Mehta. She is a professor in the Department of Psychiatry, All India Institute of Medical Sciences, Delhi. So let's now request Professor Girish Mishra to dwell on this theme of culture and self. Sir.
We as human beings start our life in specific cultural settings. As man-made part of environment, we live with certain attitudes, we live with certain institutions which shape our thoughts. Within this sphere of culture, we develop specific notions of self and other. Perhaps in everyday life, we attend maximally to what we think about ourselves, how we conduct ourselves in various situations, how we pursue certain goals that are cherished by ourselves. So centrality of self is a very important feature and it can be easily seen. However, what kind of self a person has, this question can be understood in the context of culture in which he or she is living. Normally, we think that people come from at least two major kinds of cultural contexts. One cultural context is considered as a context which is relatively individualist, and the other cultural context is considered as collectivist. These two are broad categories. In fact, in any society, one can see that people have elements of individualist as well as collectivist notions, and people negotiate between these two kinds of self-images. The individualist kind of cultural setting emphasizes on an individual who maintains a solid boundary around himself or herself. The individual tries to perform activities in relation to the goals set by himself or herself. The relationships are secondary. The boundary which separates self and other is drawn in such a manner that there is little possibility of movement from the other to the side of self or from the side of self to the side of other. In contrast, in cultural settings where collectivist orientation is relatively stronger, we notice that there is mutual constitution of self and other. The self tries to relate to others in significant way, and the important thing is that self is defined by the relationships. The self of this kind is often called interdependent self as compared to the individualist self, which is considered as an independent self. But as I have mentioned earlier, both these are extreme cases. In any particular individual, one can notice elements of interdependence as well as independence. In the Indian context, where relationships are very strong, family orientation is very crucial for taking decisions for the individual, where individuals are embedded in the social context, the collectivist and interdependent mode of self is considered to be more important. The kind of self which we have is actually a product of a number of influences. Family is one, school is one, the religion is one through its different elements. All these sources provide inputs towards the formation of the notion of self. As a matter of fact, as one of the important sociologists, Mead, has mentioned, self lies in the dialogue between I and me. It's a relationship between the subject and object, I and me, how the two relate. The part which is called me comes from the social context, and this inner dialogue is always considered quite central to the formation of association with other individuals, guiding one's goals. In the Indian context, self has been looked at as a multi-layered structure. You must have come across a model which is called Panchakosha model. It is available in Upanishads. It talks of the surface layer as Annamaya Kosh, which is bodily, which is physical, which talks about the material level of reality. So one is a being, and one element of that being is the physical being. But the physical being is not everything. Annamaya Kosh is one level. The second level is called Pranamaya Kosh, vital level. Then there is a mental sheath, Vijnanamaya Kosh, and then finally they talk about a state or a layer or a sheath which they call the level of Manomaya Kosh, and ultimately there is a level which is called Anandamaya Kosh, which is the level of bliss. I just wanted to make you familiar with the idea that a human being is a physical being, is a social being, and also a spiritual being. So it's a multi-layered hierarchical structure. When we think of attending to self, we need to attend to all these levels of existence. In many traditions, the spiritual self is considered quite important, and the spiritual self is often contrasted by a self which is largely egoic, which talks of body, which talks of the needs of individual, and which emphasizes that one should do everything, one should do anything to realize one's personal goal. In fact, many notions of well-being are related to personal well-being. There is also social well-being. When we talk about spiritual self, we talk about non-egoic self. When you go beyond your boundaries, when you go to the social world, when you relate to the social world, then you become spiritual. So the moment you think that you are part of a broader reality, your self is extended. In one of the traditional statements, it is said that whatever is in macrocosm is represented in microcosm. So there is certain degree of continuity between the individual and the broader self. Understanding this kind of relationship invites us to engage with the notion of self which is broader. Today, when there is greater emphasis on consumerism, we find that people are defining themselves in terms of possessions, what they have, and they strive to possess more and more and more. This kind of concern is creating a variety of problems at the level of individual as well as at the level of society. We as human beings have to understand who we are. Know thyself, or Atmanam Vidhi. These statements are very old and they are really today posing questions which are very central to our existence. We need to understand ourselves, and the problem is that we are not always aware about ourselves. What are our goals? What are our competencies? Are not always known to us. A counselor's role is to help the client to understand his or her competencies, strengths, what are the weaknesses, and then extend a kind of help which creates insight, which provides insight into self-understanding. Srimad Bhagavad Gita, which is very famous Indian treatise, says that self is one's greatest friend and self is one's greatest enemy. If one understands self properly and manages one's lower self with this higher self, perhaps he will be a person who is getting everything, who is enjoying life, who is a Jivan Mukta. One need not go beyond this life to enjoy mukti or liberation. One can live in this life and being a person who does duties, who performs various activities which are required, at the same time maintains a distance in terms of what are the gains. In other words, those gains are there, but they are not prominent in terms of guiding forces to choose different alternatives. So, this kind of orientation, which enlarges the meaning of self, may be of some help to understand the problems. And the notion of self is one which is always a dynamic notion. It always changes in terms of our experiences. Siddhartha had one notion of self. When he realizes what are the problems in life, his self changes. When he becomes Buddha, his self again changes. So, the course of self changes in the lifespan. It depends on the cultural context, and I hope by looking at the various cultural processes, we can understand the notion of self as experienced by individual and as it relates to the normative self which is prescribed by a given culture or community. I think one needs to attend to both the processes. Most of the problems which we experience in our life relate to the conflicts which are in the domain of self. The anxieties, the insecurities, the kind of struggles which we have, they emanate in the processes of self. So self-understanding is perhaps the first step as well as the last step in any counseling process. Through counseling, we make an endeavor to understand, to clarify what kind of self is there which one wants to pursue, and what are the difficulties and problems which are there with that kind of notion of self. And through various kinds of interventions and procedures, you develop an understanding to see those conflicts and to become aware about your own experience and understanding of self. Thank you very much.
Thank you, sir. This really was an insightful talk which indicates to us how much are the cultural differences that exist. For instance, the individualistic Western notion vis-a-vis the collectivistic Indian notion, even if there is an amalgamation of the two somewhere along the line on the continuum. But the fact that there are distinct construals of self of individuals belonging to different cultures, and the implications of the same in the context of counseling and family therapy needs to make us very cautious in the context of extrapolating the Western notions and methodologies in the context of counseling and family therapy, and the need to reevaluate the same and make sure that the counseling approaches, interventions, strategies, methods, the very foundations of counseling and family therapy that we employ in the journey that we have begun with the commencement of this program of study, particularly vis-a-vis the students who are now going to enter into this domain, we need to be therefore very well informed about the implications of the construal of self and the need to have our practices and the theoretical concepts and construals well grounded in the Indian socio-cultural milieu and reality. And now I would request Professor Manju Mehta to deliberate on the significance of communication in the context of counseling and family therapy.
Thank you, Dr. Chedda. Thank you for giving this opportunity to interact with students through this satellite. And I think I've got a very important topic on communication, role of communication in family therapy and counseling. You all would understand that when a counseling or therapy session is to be taken, the vehicle through which or channel or mode, whatever you may like to call it, on which you take the journey of understanding problems of the patient and from there going to the solution of the problems, that entire journey is on the basis of communication. Communication means that you are able to convey your own thoughts clearly to the client. What you are saying, the client should be able to understand that, and what your client is saying, communication should help you to understand that. So communication is two-way process, both from therapist to client and client to therapist, and it's very important that how we communicate. In this we should understand that it's not only talking, but communication is actually a very broad type of thing in which we have to understand that how our thoughts, our emotions, our feelings all are conveyed in the proper manner. So in counseling, there are lots of skills that you know that it's very important that a counselor should have. And amongst all these skills that we are talking about, that empathy or respect and positive regard, warmth, genuineness, in this, all this is possible because you are conveying this through your communication. Like, for example, if it is you want to show that whatever the problems the client has, you still respect him for what he is. So it is not only just talking, but ensuring him to go on to speak your problems, as well as to convey through your body language and to convey through your words that yes, you are encouraging him to open up with you so that the problems can be worked on. Importance of communication skills is because, number one, you have opted for to become a counselor, and when you're becoming a counselor, you have taken responsibility of trying to help the client to solve his problems. So through good communication and caring attitude only, this goal of counseling can be achieved. And whenever you find that there is a person is not able to understand you, or you are not able to understand the client, then the therapy does not take place. The therapy cannot proceed because certain blocks in communication they come which interfere with the therapy, and the client is not satisfied and you are also not able to deliver well. If we talk about communication skills in the counseling situation, these are like, you have to establish rapport, you have to actively listen to the problems, there should be eye-to-eye contact, there should be questioning skills. Especially in family therapy, lots of things are on the questioning skills, how the interview is taking place, through interview how you are eliciting information, and empathy. All these are only through communication. If we come again on it, it is communication is act of imparting knowledge, because you are providing, your client wants to know that why I am not able to sleep, why I get anxious. So you have to give him reasons for that. You give him certain knowledge about his situation and problem. There is exchange of feelings. Communication is also important for counselors when they are writing their reports. Also, when they are expressing, and non-verbal communication is also very important. So all the interactions between the counselor and the client, they are based on communication skills. Through communication, we are creating a relationship, and this relationship helps us to make our client very open, so that he gives out the real information, something which is bothering him, though he may be ashamed of many times giving that information. But through your communication, the person should feel very comfortable to talk about his problems, and then solution to problems and the process of change would follow in the line. Now, how do we express ourselves? Because communication is expression. So both verbal and non-verbal behavior is, and words that we are using, is very important. Now, many times it happens, I'll give you an example, that if you speak a language which is not understood by the client. For example, recently there was one particular counselor, and he expressed in a certain way that the patient was improving not because of his efforts but because of the medication, and that made the person very disturbed, because he said, I am putting in so much effort, I am doing so many things, so why I have failed in taking this thing, though the person did not mean like that. So the words that are selected are to be done very carefully, and you also have to understand the meaning of the words which the client is using. Many times the client may, because of, you have just now heard about the cultural aspect of the counseling. So in certain cultures, certain expressions are used which may have different connotations. So here you have to bring in understanding the client, you have to understand from which background, from which cultural background he is there, and to understand the words that he is using. You also need to understand the voice tone, because many times the tone, whether it is enthusiasm is there, motivation is there, person is feeling anxious, feeling low about particular thing, or hesitant, all these behaviors can be judged only through tones. So you have to be very careful about the voice tone of the client to understand what he's trying to say. Facial expressions are also very important. If the person is looking down, is looking straight, he is trying to show anxiety, or he is showing disturbed look, even in period of silence is very important, because in period of silence the expressions tell us what thought process is going through, what emotions are going through the client. So these things would come when you are observant of the facial expressions and try to fake out what your client is trying to express. The body language and the gestures are also very important. So these would lead to understanding of the things. Now when we are talking about it, there are some situations in which it's very important about what is the type of language which is being used. It's important to use simple language. In simple language, sometimes a person is not very educated, and if you use technical language, for example, you say that you are using defense mechanisms, the person will not able to understand. So you should convey your feelings in simple language which that client is able to understand clearly. Sometimes we are talking to children, we are giving counseling to the child, and the child may not understand what adult language is. So many times they may get confused. Many times we may use English words and the client may not understand that. So taking into consideration the educational background, the age, with that, if we are trying to communicate, the communication would be much better. Another important thing is in communication there should be also respect, which is important. If you talk to the elderly person and you address them in Hindi as tum, or you talk in certain ways which a person may take as disrespectful, so it should also be age appropriate words which have to be used, so that the client is not offended by your use of language or how you are trying to adjust. Because the moment you use certain words, and if your client gets disturbed about it, it immediately would bring thought blocks into him, and it would be a communication block, and person will not be able to communicate freely, and the therapy will not progress. It is also very important in this that when we are taking interviews in psychiatry or in mental disorders, or whenever a person is disturbed, he is anxious, there is a tendency to repeat and to say things in much longer way. In this situation, your communication skills should help you to make out at what point you have to redirect the person or refocus the client, so that in short time you are able to take maximum information. So this again would be very important when you are dealing with the communication. Advantages of communications are in various situations, because the client satisfaction would come only when you are communicating well with them. If you do not communicate well, the client may be having a doubt whether the counselor has understood my problem. Is it I'm being given the right therapy? Is it that I have gone there but my problem has not been solved? So client satisfaction would actually bring in progress in the therapy. There's another very important thing is that improved health or emotional outcome is possible with good communication. Because if your communication is good, the compliance becomes better. The patient wants to come back to the sessions that you have called him, if he is not satisfied, he does not understand you, there would be a resistance and he may not come in time for the session, or he may ask for excuses. So if you want that therapy has to progress in a desired way, again your communication skills are the key factor in that improvement. Also, we know that when we are doing counseling, we are not dealing with lots of medical problems. We are dealing with psychosocial issues. Either they are conflicts, interpersonal conflicts, or even understanding of the self. In that also your expectations, your anxiety, all these are psychosocial issues. And psychosocial issues can be elicited only through communication, through interview with proper questioning skills, and for this you need to develop expertise. Communication is also important when we are dealing with lots of litigation matters, and wherever there is a conflict situation, or these days marital problems are there, family problems are there. So anywhere, wherever there is a litigation, lots of solution to the problem can come by negotiation, and negotiation again is based on communication. There are some tips for good communication. Be an active listener, maintain eye-to-eye contact, speak calmly but assertively, use simple language, be brief and clear, use open-ended questions. It's very important because in this the person will be able to bring out answers. If you give close-ended, it would be only yes or no. Summarize and seek clarifications and give respect to the. Now the question comes, do everybody has communication skills? Can communication skills be enhanced? Yes. Communication skills can be enhanced, and especially when you want to become a good counselor and a family therapist, try to analyze yourself, and if you think that you need some improvement in your communication skills, then definitely you can learn these skills, you can get training into this. And in this, how would you do that? It is very important in this that you observe other people. When you will go for training, or even you can watch lots of people on the TV or various speakers for the courses that you are trying to listen, in that observe their communication skills, and through observation you can make points which are the good points and try to follow that. Practice them. Sometimes even you can do role plays. And for counseling and family therapy, lots of videos are available which you can watch, and through watching those videos you will be able to learn good communication skills. You can also take help of your colleagues by asking them for their feedback, that how do you communicate. You can sometimes also get indirect feedback from your clients, and this would help you to improve upon your communication. So remember, the words that you choose, they are very important, and the right type of therapy would follow only by using correct words and conveying your feelings and understanding your feeling of your client properly. I think with these tips they would be able to now use and take care of how they are communicating, so that the therapy progresses well.
Thank you, Professor Mehta, on dwelling on this vital aspect of communication in counseling and family therapy, which, if you look at it, forms the very backbone of the whole process of counseling and family therapy. Developing effective skills is a key skill that one needs to develop if one has to function in the field in any effective manner. And the practical tips, which could only be derived on the basis of years of experience and having handled scores of clients in the course of working as ma'am has been in this area. Well, thank you, ma'am, for sharing those tips with us and all the aspiring practitioners in the field. Basically now, one can only dwell on the summative aspect. One needs to keep in mind, now the two sessions have been related to some extent, you need to keep the cultural milieu in mind when you're handling your patient, because the self vis-a-vis the person who is to be helped and the self of the counselor, of the therapist, both play a key role, and both are rooted in a socio-cultural milieu. As Professor Girishma Mishra rightly pointed out, the what is outside gets imbibed as well into the very psyche of the individual, be it that individual could be the counselor or the person who is to be helped. So the awareness vis-a-vis these aspects, the rootedness of the internalization of the cultural milieu into the psyche of the individual, the need to keep this aspect in mind when one is communicating with the client, the need to be aware of the influences which mark the what one communicates to the other person and the perception of that communication by the other person. So the vital tips, the in-depth knowledge, the insights we've gained from the two talks are going to be very useful for us as we pursue this program in counseling and family therapy. So once again, let me put on record our thanks to Professor Girishma Mishra and Professor Manju Mehta for joining us on this session. Thank you very much.
Thank you.
Thank you.